Hey guys, it's Dr. Bickling from Own It Dental. As always, here's my contact information if you need to get a hold of me. And if you guys are enjoying these videos, please do hit that like button, hit that thumbs up button. It's right down below. It only takes you a second and it'll make me feel good. I'm sure you can empathize. Today we're going to talk about empathy. But before we do, first we need to know the difference between sympathy and empathy. So that way we can use empathy to get our patients to say yes to the dentistry that they need. So let's dig into it. All right, so like I said, today we're going to talk about the difference between sympathy and empathy, and then how I use empathy to get patients to say yes to the dentistry that they need. Because at the end of the day, it doesn't matter how much dentistry we diagnose. It matters how much dentistry the patient says yes to. Because if they don't say yes, we're not helping anybody, right? So I use tactical empathy as one of the best tools that I have in order to get patients to say yes to the dentistry that they need. So, but before we do that, let's dig in a little bit to the difference between sympathy and empathy, because I think a lot of us dentists, we've got a lot of sympathy for patients, but I don't think we use empathy really well, or at least the best that we can when dealing with patients. So let's first dig into the meaning. So sympathy, it's a Greek word, sim meaning same, and pathy or pathos meaning disease, so it's the same disease. Now the problem with sympathy is that when we have sympathy for somebody, we feel sorry for them, and when we give them our sympathy, what are we trying to do? We're trying to make them feel better. In other words, we're trying to make them feel more like us. So the same version is we're trying to put them into our shoes. We understand their situation, we feel bad for them in that situation, we offer them our sympathy, but the goal of that is to get them to feel more like us. And it's kind of like the opposite of empathy, or two sides of the same coin, because empathy, again, you're understanding what the patient's going through. M meaning in, and pathos meaning disease. You're putting yourself into their disease, right? So it's a bit of a subtle difference, but one is you understand what they're going through and you're trying to put them into your shoes. The other, empathy, is you understand what they're going through and you put yourself into their shoes. Now, what does this look like in real life? So this little diagram here, I think, says it the best. Sympathy is like, hey, somebody's going through something and you're like, hey, I feel sorry for you. That must hurt, kind of deal. But you're not really in that situation. You're not really feeling what that patient feels. Empathy is when somebody's going through something and you try to feel what they're going through. You try to understand what they're going through. In dentistry, it's kind of like this. Let's say a patient comes in and they've got periodontal disease, right? Most of us were like, oh yeah, that sucks. You need, scaling and root planing, right? But empathy is, what does your breath taste like or smell like? What does your saliva taste like? What are the little barnacles on your teeth? What do they feel like to your tongue? When somebody gives you a $1,200 treatment plan and you don't have $1,200, what does that feel like on the inside? So that's empathy. Empathy is understanding the patient's perspective. When you have a tooth pulled, what does that socket feel like to your tongue? What does the taste of blood taste like when you're working on a patient? That's empathy. If you tell a patient they need a full set of dentures, I have to extract all of your teeth. Sympathy is, well, I'm sorry you need this, and here's what's going to happen, and you're going to come in, and blah, blah, blah. Empathy is understanding, you know, what's it going to feel like when that doctor is taking my teeth out? What's that going to feel like, again, to my tongue when I'm feeling the socket? What is the taste of, what does it sound like, when a tooth cracks or something like that? Are they able to get me numb because of infection or periodontal disease? And how long is this going to take? How long do I have to sit here? All of that's empathy. It's a very, very different way of thinking about this. So there's kind of like the golden rule. There's a golden rule of sympathy and a golden rule of empathy. The golden rule of sympathy is just like the regular golden rule. Do unto others as you would have done unto you. But again, that's putting the patients into your shoes. That's treating the patient the way you want to be treated. Empathy is do unto them, do unto patients the way they would have done unto them, right? It's understanding their perspective and how they want to be treated, understanding what's going on in their lives, and then just making the dentistry fit into that. So why are we even talking about this? In the United States, the average case acceptance is about 30%, meaning for every dollar that's diagnosed, only about 30 cents is actually completed. And in my opinion, I think that's terrible. I think we dentists are doing a terrible job at getting patients to say yes to the dentistry that they need. And we can blame all kinds of factors and whatever, but at the end of the day, it's been proven scientifically with studies that it's mainly patients just don't trust us. They think we're upselling them, they think we're overcharging them, and to me that's just very sad. But yet, if we could get them to trust us, then we could get them to say yes to the dentistry that they need, and that's the whole goal of tactical empathy, is just gaining the patient's trust. The first step in doing that is just simply becoming an active listener. And in order to become an active listener, you can't be talking at people. You got to be asking questions, so that way you can listen. These are my trust collectors. I collect trust with these, not with this. So in any case, so we ask questions. If we ask the right questions and we get the patient to talk enough, then they're going to feel like they've been heard. They're going to feel like you understand their situation, right? And then our job is very simple. Our job is just to make the dentistry fit into their life, but first they got to feel like we've been listening to them, like we hear them. Yeah, I hear you. I understand what you're going through. I understand what the obstacles are and how that must make you feel. And these are the things that we're going to do in order to get that dentistry done, but make sure it fits within your life. So that's empathy. Here's kind of the difference. Dentistry, this is typically how dentists go about dealing with things. Mr. Jones, I'm sorry you're having that problem, that missing tooth or whatever it is, the cracked tooth. Here are your options. These are the pros and cons. The front desk will go over any insurance information with you, here, you've got 3 different options, good, better, best. And obviously, if they don't pick the best option, that makes them feel like a second class or a third class citizen. So don't say that. Or here's what I would do if I were in your shoes. Again, you're trying to put the patient into your shoes. This is typically what dentists do when talking to patients. I suggest we do something different. We do a little differently. We become an active listener. And again, in order to do that, we have to ask questions. Tell me about that missing tooth. Tell me about that cracked tooth. Are you interested in replacing it? Yes or no? If the answer is no, you say, why not? Again, ask a question. If you say why not, they're going to tell you the objection. And then, you validate their objections. Yeah, I understand. Would you like something that comes in and out or something that stays in place? Here's a couple of options for you. This one costs so much and takes so much time. And this one costs this and takes this amount of time. Which one of these works better for you? Question. Right? So when I'm talking to a patient, I'm talking to them in questions. I'm listening to their answers, and I'm trying to have the dentistry fit into their lives versus me talking at them, giving them the good, better, best, and the 3 different options. And the money lady up front will go over your options with you. Do you have any questions for me? Have a nice day, right? So in other words, think of it this way. The way we view dentistry is almost antithetical to the way patients view dentistry. And instead of us thinking about it this way, we need to think about it this way. So, we want to do the dentistry on them, right? It's understandable, but they don't necessarily want to have it done on them, right? So it's a bit of a conflict there. We want to make lots of money as dentists. Of course, we deserve to. We do a lot of great things, and we've gone to, we do some things that, other doctors can't do. But the patients can't necessarily afford it all the time, nor do they necessarily want to pay for this stuff, right? So you want to tell the friends about all these cool procedures that you're doing, but the patients want to feel like a person, right? They're not a procedure, right? They're a person. You want the patients to come in on days and times, the 4 days a week that you're working, Monday through Thursday, 8 to 4 or whatever, but the patient wants to come in on days and times that they're available. You want to take your sweet time and do a great job. And again, all of this stuff is normal and it's all good stuff, but you also have to understand it's antithetical to what the patient wants. So, we need to think about dentistry along these terms. This is how the patient's thinking, and we have to let them know that we understand their perspective. What is dentistry like in their minds? So you can have both of these at the same time. It's just, we got to understand most dentists, we're thinking like this, and we need to start thinking a little bit more like this. So anyway, like I said, your job as a dentist is basically to understand the patient's perspective and then create the dentistry or the dental treatment plan that fits into their lives on the days and times that they're available and solves all of the problems that they might have. So, and that's the challenge that we really have as a dentist is doing this. So again, we need to put ourselves into their shoes, not trying to put them into our shoes and telling them how much we know. So, In any case, again, I'm Dr. Pickling. I hope you enjoyed this video. Here's my contact information, and I'll see you on the next one. Talk to you soon. Bye. If you enjoyed this video and want to see more content like it, go to ownitdental.com or click the link above and check out my services. I have dozens of hours of training videos and have negotiated reduced lab fees for all my clients. So if you want to get out of the dental chair and start owning your business, go to ownitdental.com and check out my services, and I'll see you soon.